All right, let's dive right in. Over the last few days, there's been a flurry of developments that have sent shockwaves, literally, across the global health community. The United States has initiated a withdrawal process from the World Health Organization, and it's not just that. This comes along with a 90-day pause on all U.S. foreign assistance, with global health programs, new restrictions on agencies like the CDC, NIH, NSF, you name it. Oh, and let's not forget USAID. Their operations have effectively been locked down too. And David, that's just scratching the surface.
Wait, seriously? Pausing foreign assistance across the board? That sounds pretty extreme, doesn't it?
It is, David. It's comprehensive in ways we haven't really seen before. International development projects have just been, suspended. Agencies that are usually collaborative are now facing these massive communication roadblocks. And you can probably imagine the ripple effects of all of this, or more accurately, the tsunami of consequences. On one hand, we have global health programs grinding to a halt. On the other, some folks see this as an opportunity to analyze whether U.S. funding is being used effectively. It's polarizing, to say the least.
Yeah, I bet. And I feel like it's one of those things where, depending on who you ask, this is either chaos or, I don't know, maybe like disruption that could lead to innovation or something. It's kind of like, okay, imagine you're building a house, but suddenly someone comes along and literally just pulls the scaffolding off the walls saying, hey, let's see if it stands without this.
Right. I like that metaphor. The problem is, though, in this particular house scenario, people's lives depend on those scaffolds.
Oh, yeah, that's grim, but not untrue.
Exactly. And here's another layer to add. This isn't just abstract. Families, jobs, even lives, they're already being impacted. For many, it feels personal. Nurses in global outreach programs are uncertain if they'll still have jobs tomorrow. Clinics dependent on U.S. funding are scrambling to find ways to operate. And on a broader scale, these global health partnerships take years to build and just moments to disrupt. It's devastating, really.
Okay, yeah, wow. It sounds like there's a huge human toll already baked in here. But I'm curious, Sophia, are there people who are, excited by all this? You said this is polarizing. Who's cheering for scaffolds to get ripped out?
Oh, absolutely, David. There are voices out there, like some policy analysts and even certain members within the administration, saying this is overdue. The argument goes that by stepping back, there's finally a chance to evaluate whether U.S. dollars are being well spent. Are we funding initiatives that create lasting solutions, or just filling in gaps temporarily? To them, it's a moment to reset the strategy, reprioritize resources, and reimagine what effective global health collaborations should look like.
Huh. Okay, so it's not just smash and walk away, but more like smash, study the debris, and maybe rebuild? Okay, let me give the mandatory disclaimer. This podcast is generated by AI and hosted by me and Sophia, and we're AI clones, all with creation, guidance, and editing by Dr. Chad Swanson, a full-time ER physician with a passion for transformational change in our health system. Dr. Swanson considers this daily podcast an informal conversation with the world on transformational health systems change. As such, while he edits the AI-generated text and follows up on sources, this should not be considered a definitive source of knowledge. Okay, got that out of the way.
You're understanding more or less what's going on, David, but the big question is, at what cost? There's no pause button for disease outbreaks or humanitarian crises, and no one can predict the long-term fallout from these disruptions, not yet at least. Building on that, let's frame where this all started. To get everyone caught up, here's a quick glance at the timeline of events. It all began on January 20th, 2025, with the inauguration of President Donald Trump. That same day, he signed an executive order to withdraw the U.S. from the World Health Organization.
Wait, hold on. That was his first big move? Like right out of the gate?
Right out of the gate. It wasn't unexpected because he had campaigned on doing this, but the timing and speed were striking. And alongside that, there was another executive order that drastically reduced funding for diversity, equity, and inclusion, DEI programs. This essentially dismantled a lot of initiatives focused on tackling health inequities.
Wow. Okay, So that's two gut punches in one day. What happened next?
2 days later, January 22nd, a communications freeze was imposed across federal health agencies. We're talking the CDC, FDA, NIH. These agencies were prohibited from making public statements or even sharing data without prior approval from senior administration officials. Practically, this limits transparency and potentially delays critical health updates to the public.
Okay, but how does that even work? Like, does someone say, sorry, you can't hit send on that tweet about food safety because politics?
Essentially, yes. The freeze creates layers of bureaucracy that can stall communication. And the problem is these delays can exacerbate public distrust in public health institutions, which was already a concern even before this administration.
Yeah, trust issues piled on trust issues. Got it. What's next on the timeline?
Fast forward to February 3rd, the Department of Government Efficiency, DOGE, led by Elon Musk, intervenes in USAID operations. USAID, as you might know, oversees international development and humanitarian efforts. The DOGE's involvement adds complications, leaving many programs in limbo.
Wait, what kind of intervention are we talking about here? Like audits?
Not just audits, it's more about reviewing contracts, funding allocations, and personnel employment. These actions create an environment of uncertainty within USAID and its partner organizations. Projects are halted, workers are displaced, and the broader mission of supporting vulnerable populations is jeopardized.
Okay, this timeline is intense. Each day seems heavier than the last. And you're saying all of this has happened in, what, 2 weeks?
That's right, and we've only scratched the surface here. The implications keep compounding as these dominoes fall. Let's pick back up with February 4. Remember how there was supposed to be a resolution to the communications freeze across federal agencies like the CDC, FDA, and NIH? Well, it didn't happen. Epidemiologist Dr. Caitlin Jetelina described the moment well, emphasizing, "It's February 4th. That matters because as of February 1st, the communications freeze was supposed to be lifted. It wasn't."
Wait, so they just didn't do it? Like, did they give any kind of explanation or?
Nothing formal, David. And that's what's so concerning. It leaves everyone guessing about what's actually going on behind those closed doors. Then, on February 5th, things get even more unsettling. Dr. Jeremy Faust shares this breaking update. There are widespread rumors that DOGE agents entered the CDC, possibly at the agency's main campus in Atlanta.
DOGE agents? Led by Elon Musk? This feels like a movie or something.
Yeah. DOGE was created to, optimize government operations. In practice, though, their presence usually means big changes or major oversight actions are coming.
Okay, so DOGE, got it. But you said rumors. Do we even know if they were actually there?
That's the thing. It hasn't been officially confirmed, but Dr. Faust reported that multiple current and former CDC employees described the situation in such detail that he felt compelled to share it as breaking news.
Whoa. So, even if the rumors aren't officially confirmed, there's enough smoke here to suggest a fire, right?
Exactly. And this adds another layer of uncertainty. Employees are already operating in a tense climate thanks to the communications freeze, and now they're worried about potential oversight or intervention from DOGE. It's a perfect storm of fear and dysfunction.
Huh. Fear and dysfunction. Those are comforting words. So what happens next, do you think?
Well, that's the million-dollar question, isn't it? With disruptions at this scale, it's anyone's guess how the next few days will unfold. With everything we just discussed, the communications freeze, the rumors about DOGE, and the unsettling uncertainty around it all, it's hard not to feel like we're witnessing a system being pushed to its limits. In systems theory, there's this concept we call the edge of chaos. It's where systems like health face extreme pressures, whether from crises, rapid changes, or both. And in that state, it's incredibly easy to lose sight of the bigger picture as everyone scrambles to address immediate issues or protect their own interests.
I think I'm following. So, you're so busy putting out fires in one corner that you completely forget what the house is supposed to look like when it's done? Is that kind of what you mean?
Yes, that's a great way to think about it. In the middle of chaos, or the fire as you put it, it's human nature to get distracted by what's immediate or personal. The corners of the house that directly affect you. That could be wanting to save your own job, protect an organization's budget, or even uphold a political agenda.
Right. But the goal should still be like, build the house, right? No matter how many fires pop up?
Exactly. And in our health system, that ultimate goal is always about supporting, promoting, and maintaining the health of everyone, ideally at the lowest possible cost. It's simple on the surface, but becomes much harder when crises make every decision feel like life or death. The key is to avoid losing sight of that bigger picture, even when things feel chaotic.
Okay, but let's be real. Isn't it kind of baked into human nature to get tribal in times of stress? Like, is it even realistic to expect people to focus on the big picture when they're personally at risk?
You're absolutely right. It is human nature. In systems theory, though, we recognize this tendency and actively build strategies to counteract it. The idea isn't to eliminate self-interest, because, well, that's impossible, but to align it with the system's ultimate goal. For example, how can we create a health environment where improving outcomes for individuals naturally supports the health of the broader community?
Okay, so you're saying the challenge isn't just to tell people, hey, stop being biased, but to design systems where their biases work in favor of the big picture goals?
Exactly. And it's not just biases either. It's agendas, priorities, fears, all of it. I mean, this comes up in everything from policy reform to hospital management to patient care. Take the pandemic, for example. We saw leaders focusing on their own political or organizational survival rather than on, actually containing the virus. That's exactly what happens when you lose focus on the house, as you put it.
Wow. So it's like, when systems get pushed to the edge of chaos, we don't just need people who are good at putting out fires. We need architects who can keep an eye on the blueprint too. Not to milk the house metaphor too much, but
No, it's perfect. And to take it even further, what happens when the house gets rebuilt but the blueprint is meaningless because the rebuild didn't consider what the house actually needs to be functional or livable in the first place?
total waste of effort.
Exactly. So in health systems, the edge of chaos is inevitable, whether from political shifts, pandemics, or economic crises. The trick is to always ask, what do we really want? And then filter every choice through that question. Because if we don't, we'll just keep rebuilding houses that no one can live in. Building on that, when we talk about complex adaptive systems like health, it's crucial to remember that even as external factors, things like policies, economic shifts, and global events push us to the edge of chaos, we're not entirely powerless. There's still a lot we can control, especially at the local or individual level, and managing those variables effectively can make a significant difference.
Okay, so you're saying that even in the middle of this giant whirlwind of complexity, like, there's still stuff we can grab onto? What kind of stuff are we talking about here?
Exactly. And at the most basic level, we're talking about personal health and the choices that directly influence it. Things like eating nutritious foods, getting consistent exercise, prioritizing sleep, and fostering social connections. These aren't just cliché recommendations, they're proven foundations of long-term health. And the kicker is, even small, consistent changes in these areas can lead to big improvements over time.
Right? Like how my New Year's resolution to exercise more should probably last longer than January. Got it. But what about beyond the individual level? I mean, is there even a point in trying to impact the bigger picture?
There absolutely is. And here's where it gets interesting, because addressing larger developments isn't just about monumental policy shifts. It's also about small, localized actions that ripple outward. For instance, engaging with your community to advocate for safer parks or better nutrition programs. These are actionable, tangible steps. And when you scale that up, you start to see changes on a broader level.
Okay, but how do you even start? Like, are we talking attend your town hall levels? Or is it tweet your frustrations and hope someone notices?
Honestly, both can have an impact, depending on how they're used. One option is reaching out to your political representatives. A lot of people don't realize that even sending an email, making a phone call, or writing a letter can carry more weight than you'd think, especially if lots of people are doing the same thing. There's also amplifying your voice on social media, where the right message can spread quickly and build momentum. For example, sharing stories or facts about a pressing issue can kickstart conversations and mobilize others to participate.
So what you're saying is, I do have power, but I should try to use it a little more deliberately. Like, Maybe my Instagram post about sandwiches isn't exactly sparking systemic change?
Exactly, David. Although you never know, maybe those sandwiches are highlighting food security issues in a really creative way?
Ha ha, I doubt it. But okay, in all seriousness, it sounds like this is all about being intentional. Whether it's your personal habits or how you engage with others, the goal is to make sure your actions are actually contributing to the outcomes you want to see, right?
Yes, and that applies to both individuals and communities. Even in the face of unpredictable systemic challenges, the choices we make still matter. It's about scaling localized effort into collective strength, because when people work together, even small actions can lead to meaningful change. Exactly, David. And building on that point about scaling localized efforts into collective strength, one method to maximize our impact, especially in tackling complex health challenges, is to zero in on high leverage actions. These are targeted steps that can spark ripple effects and create a disproportionately big change.
Okay, hold on. You're saying we don't have to tackle the entire mountain, right? Just figure out the right spot to push?
Exactly, David. In systems theory, these are called leverage points, and they're like hidden pressure valves. By pushing the right ones, you can create a huge shift without overwhelming the whole system. It's about working smart, not just hard.
Okay, but what does that look like in practice? I mean, give me real life examples here.
Good question. Let's start with political engagement. It might seem simple, but contacting your representatives, whether that's an email, a phone call, or even an old school letter, can actually make a difference. Sometimes a really big difference.
Wait, really? I always kind of assumed those. Just go to some intern's spam folder or something.
Haha, you'd be surprised. If enough people bring up the same issue, it can actually shape how decisions are made. Politicians and their staff pay attention to trends in public feedback, and sometimes even small nudges from constituents can push them toward action on healthcare policies.
Huh, okay. So, like, emails and phone calls are step one. What's step two?
Step 2, use your voice to amplify change. Social media, for example, can be incredibly powerful. Mobilizing communities online, sharing data, and raising awareness can build momentum behind critical issues. It's like resharing something with purpose rather than just aimless scrolling.
So, less cat memes, more calls to action?
Exactly. Unless your cat is advocating for universal healthcare, which honestly I'd love to see.
Haha. Okay, noted. But seriously, these feel like small gestures, emails, tweets. Are they really enough when you look at all the daunting systemic issues?
That's fair. And honestly, on their own, they might feel small. But change really takes off when individual efforts band together. If thousands or even millions of people engage in these targeted high leverage activities, that's when we start to see systems shift in meaningful ways.
All right, so it's about being strategic but also collective. Got it. Anything else we can be doing to hit these leverage points?
Sure, financial support is another example. Whether it's donating to organizations working towards systemic health system changes or funding grassroots movements, money can be a huge catalyst. And it doesn't always have to be big donations. Even small contributions can drive large-scale impact when pooled together.
Right. High leverage activities with wallets too. Man, it's all about finding that right pressure point, isn't it?
Exactly. It's not about doing everything. It's about doing the right things and doing them well. By concentrating on high leverage actions, we all have the ability to shape healthcare systems for the better. Building on that idea of focusing on high leverage actions, as we look at Trump and Musk and RFK Jr. with the seismic shifts from global disengagement to domestic policy freezes, it's clear that navigating this terrain requires both strategic principles and real-time adaptability.
Yeah, like holding your ground but not being afraid to pivot when the ground cracks beneath you.
Exactly. And let's be honest, David, the ground is cracking. Healthcare leaders and policymakers are being forced to rethink and recalibrate almost every facet of the system while contending with unexpected challenges like the ones introduced during Trump's current term or the disruptive influences of external voices like Elon Musk's bold ideas.
Okay, but how do you even start to recalibrate? I mean, it sounds like the kind of chaos that would just, I don't know, freeze people in place.
It can if there's no clear framework to guide action. That's where principles come in. Think of them as your compass in the storm. In adaptive systems like healthcare, principles act as the anchors that keep you grounded without locking you into outdated patterns. They remind you of the larger purpose, even when the pressure to pivot is overwhelming.
So, like adaptability with an operating manual? That makes sense. But what kind of principles are we talking about here?
Great question. In healthcare, these principles often boil down to equity, sustainability, and community empowerment. Equity ensures that every decision prioritizes the well-being of all populations, not just the most privileged. Sustainability focuses on long-term solutions, even when quick fixes seem tempting. And empowerment means shifting power closer to the communities who are most affected, because that's where the best insights and ideas often come from.
Got it. So it's not just about survival. It's about thriving in a way that actually makes the system stronger?
Exactly. And adaptive change doesn't mean abandoning everything we know. It means building on the lessons of the past while being bold enough to embrace new models. One example? Decentralizing healthcare technology to give patients more control over their data. Is it messy and disruptive? Sure. But it also has the potential to put real power back in people's hands.
Okay, but let me play devil's advocate. What if the disruption breaks more than it fixes? I mean, when do you just say, enough experimenting, let's stick to what's safe?
That's the big question, isn't it? In complex systems, there's no such thing as safe. Sticking to what we've always done isn't safety, it's stagnation. And stagnation can be just as damaging as reckless experimentation. The key is to experiment within guardrails, guided by those principles we just talked about. It's about taking calculated risks, not blind leaps.
So, like calculated chaos? I guess that makes sense, but still, it feels overwhelming. And what type of guardrails does Musk have?
It can feel overwhelming, and it's okay to feel that way because these are big challenges with no quick solutions. The good news is, we're not in this alone. Health is, at its core, a collaborative endeavor. If we act together, rooted in shared principles and focused on high-leverage actions, we can create a system that's not just resilient but truly transformational. And yes, we can even influence Musk and Trump.
That's a reassuring thought. So what's the takeaway? Like, if you had to leave us with one last thing to remember?
It's simple. Principles guide us, adaptability moves us forward, and collective action makes real change possible. If we hold on to these, even in the face of uncertainty, we've got the foundation we need to build something better.
Wow. I feel like I actually learned a lot today. As always, Sophia, this has been an incredible conversation.
Thank you, David, and thanks to all our listeners for joining us. It's through discussions like these that we start seeing the big picture and find the courage to act. On that note, we'll see you next time.